Lady from California, the ranking member of the full committee, Ms. Waters, is recognized for 5 minutes.
Thank you very much, Mr. Chairman. Ms. Peters, I'd like to thank you for your work on the Center on Illicit Networks and Organized Crime. You know, I do believe that when citizens take up issues to work on, that very important issues that are undermining the democracy, undermining our efforts to be safe, that we really should support them. And you can't do this work without money. Do you need funds?
I mean, I can tell you our organization functions on less money annually than a company like Facebook spends lobbying Congress every single week. So our organizations have almost no money. My friend Jaime Puerta, who's here, his organization Void, which is run by parents who've lost kids to the fentanyl crisis, have reached out to more than 40,000 American kids on their own dime. There's no government funding for this right now. We would like to see more funding for education to kids and also to parents so they understand this toxic mix of misinformation that's out there. A lot of kids who are buying pills online, they're not regular drug users. They actually know that street drugs are dangerous. They think they're buying a prescription Vicodin or Xanax, as happened with Daniel Puerta. He thought he was buying a pill to kind of relax him at the beginning of the pandemic when he was trapped in his room and feeling sad. We hear that story over and over and over from families. They didn't ever hear the word fentanyl until the EMTs arrived to try to revive their dead child. There's a toxic mix of disinformation going on. Kids think they're getting safe pills. Social media platforms are teeming with drug content, and they're not required to remove it or restrict it or put up warnings about it. And parents think that the poisoning or overdose crisis won't happen to them because their kids aren't drug users. We really need to work on this information, but also where this committee can help is to really investigate the payments that are coming through the tech platforms that the kids are using to buy these drugs. We've seen a great reduction in street drug markets. The drug commerce at the retail level and also at the wholesale level has really moved online, just like a lot of regular commerce. Thank you.
Thank you very much. When you talk about the kind of work that you're doing with young people, the kind of work that families are doing who have lost kids, I'm interested in also, in addition to what you're advising us right now that should be taken seriously, what we could be doing, I'm interested in what you may think about, or maybe you've already thought about it in terms of ads and other kinds of ways that you could try and educate young people and try and influence them and tell them the pitfalls of getting involved with drugs and it kills and all of that. And what worries me, and even though you may be approaching this in a little bit different way, we see that $8 billion was diverted, including $2.5 billion from DOD, the counter drug program, $600 million from Treasury. Counter trafficking includes sanctions support and for law enforcement. So we have money that we're spending, but you know, you keep coming back like you said, and I don't blame you. You're tired. You want to see some results. And so I want to see some of this money spent to help out in ways that maybe you thought about, but certainly you have not solicited, you have not, said the government, we can't do this without you, you're doing it. But wouldn't some of this money help you and these parents to do some of the education that these children need to have outside of, what they may hear about?
Ranking Member Waters, yes, not only do organizations like ours need money, but all the panelists have described different agencies of government that, we need to be throwing the kitchen sink at this problem. When I first testified about this, we were losing 60,000 Americans a year. This last year, the official numbers are over 108,000. It has nearly doubled in just 4 years. These are staggering numbers of people that are dying every single year. And there's not one single solution or silver bullet. There needs to be public education, extensive public education, and prevention programs, both for kids and for street youth, people who already have addiction issues. There need to be healthcare interventions to try to reach those people who already are struggling with substance abuse disorder. We need a lot more money, as Don Im and John Cassara has said, for DEA. I believe that our DOD also
Peters,
needs
your
to be
time's
involved.
Thank you very much. The chairman has been very generous, and thank you, sir. I yield back.
Thank you, Ranking Member.